The COVID-19 pandemic has highlighted the widespread mental health concerns and inequalities in access to care. In Washington state, over 20% of adults face diagnosable mental illnesses, and the past 18 months have seen a rise in prevalence and severity. Governor Jay Inslee declared a state of youth mental health crisis, emphasizing the need for urgent intervention. Nationally, 40% of adults have experienced mental or behavioral health conditions during the pandemic. Mental health challenges have long been prevalent, revealing systemic inequities in research, funding, and treatment, particularly along racial and economic lines. These disparities, along with bureaucratic obstacles, have impeded progress in meeting mental health needs. The consequences of inadequate support are severe, as individuals with severe mental illness face a significantly shorter lifespan compared to those without such conditions, with a difference of 10 to 25 years on average. It is imperative that we confront these issues head-on, working towards a more equitable and efficient mental health care system. By prioritizing comprehensive and accessible mental health services, we can begin to bridge the gap and ensure that everyone has the opportunity to lead mentally healthy and fulfilling lives. Dr. Larry Wissel, Director of Child and Adolescent Psychiatry and Behavior Medicine at Seattle Children's, aptly describes mental health concerns as life-stunning conditions. The impact is profound, but there is hope. What do we mean by mental health, behavioral health, and mental illness? Mental health encompasses various aspects of our lives, including social, psychological, emotional, and behavioral elements. It influences our thoughts, feelings, and actions, including how we respond to stress. Similar to physical health, mental health can fluctuate and change throughout life. The term behavioral health is closely related to mental health, but its definition has evolved. It can describe the connection between behaviors and overall well-being, including the treatment and support of individuals with mental and substance use condition. However, opinions differ on its use and whether it may carry a stigma or imply control over one's problems. Mental illness is different from mental health and behavioral health, referring to conditions that impact thinking patterns, mood, or behavior, negatively affecting well-being and functioning. It is distinct from developmental conditions like autism and intellectual disability, though they can coexist. Examples of mental illness include depression, anxiety, eating disorders, schizophrenia, and substance use disorders, which can interact and vary in severity. How common are mental health conditions among Washington children and adults? Washington has a high prevalence of mental health conditions, exceeding the national average. Approximately 22% of adults in the state experience mental illness, with only 5 other states having higher rates. Among children, Washington ranks among the top 10 states for severe depressive episodes and substance use disorders. However, these statistics likely underestimate the actual extent of mental health concerns, as they predate the COVID-19 pandemic and recent movements addressing racial injustice, which have contributed to the increase of mental health issues. Mental distress can present itself in various ways, and it is crucial to be vigilant about recognizing symptoms. Impairment in everyday functioning, such as difficulty concentrating, neglecting personal hygiene, or struggling with caregiving responsibilities, may indicate mental health issues in adults, as described by Jane Simoni, a professor and director of clinical training at the University of Washington. In children, symptoms may be more subtle, with complaints of physical symptoms like headaches or reluctance to attend school. It's important to take these signs seriously, as they could indicate underlying mental health challenges in children. What causes mental or behavioral health problems? Mental and behavioral health problems can stem from a combination of factors, including genetics, family history, and personal experiences. Some individuals may have inherent difficulties in managing emotions, while others may develop issues later in life. Environmental factors such as income level, upbringing, work or school-related stress, social connections, and trauma also influence mental well-being. It is important to recognize the biological and social components of mental health problems. Jonathan Cantor, director of the University of Washington's Center for the Science of Social Connection, emphasizes the significance of addressing adverse circumstances within a person's context and social environment to promote mental well-being. How are mental conditions diagnosed? Diagnosing mental health conditions is primarily based on behavioral diagnostic tools and clinical observation rather than biological tests. Unlike physical conditions, there are no reliable biological markers for predicting or diagnosing mental health conditions, although research has identified some differences in genetics and brain scans between individuals with and without mental illness. Mental health professionals use standardized manuals like the DSM or ICD to define and diagnose specific disorders, ensuring consistency in the diagnostic process. In recent years, there has been a shift in mental health research towards focusing on individuals' traits and symptoms rather than relying solely on diagnostic labels. The National Institute of Mental Health has emphasized this approach, recognizing that many traits and underlying factors can be observed across different diagnostic categories. It is common for individuals to exhibit characteristics of multiple diagnoses or receive multiple diagnoses over time due to overlapping symptoms. This complexity underscores the challenges in diagnosing and treating mental health conditions. Diagnosing mental health conditions involves a comprehensive assessment of an individual's behavioral patterns, symptoms, and clinical observations based on established diagnostic criteria. It is a nuanced process that requires the expertise of mental health professionals to evaluate and interpret the gathered information. What types of treatment exist? Mental health treatment primarily involves behavioral interventions, talk therapy, and pharmaceutical drugs. Behavioral interventions, such as cognitive behavioral therapy and dialectical behavioral therapy, help modify thoughts, emotions, and behaviors contributing to mental health conditions. Talk therapy is effective in improving emotional well-being and overall functioning. Pharmaceutical drugs like antidepressants or anti-anxiety medications are commonly used to manage symptoms. They can be prescribed by healthcare providers and help alleviate symptoms, but finding the right medication and dosage can be a trial and error process with potential side effects. Both treatment approaches continue to evolve through medical research. Both behavioral interventions and pharmaceutical drugs have their challenges as treatment options. Talk therapy may face scalability and accessibility issues due to the need for trained therapists and associated costs. It also requires consistent attendance and ongoing commitment for sustained benefits. Pharmaceutical drugs can provide relief, but there is no universally effective medication for all individuals with mental disorders. Developing effective and well-tolerated medications for different mental health conditions remains an ongoing research endeavor. It is important to recognize that the most effective approach often involves a combination of talk therapy and medication, tailored to the individual's needs. Treatment decisions should be made in consultation with mental health professionals, who can assess symptoms, circumstances, and preferences to create a personalized treatment plan. What systemic barriers exist to receiving care? Systemic barriers to accessing mental health care include affordability. Many individuals lack insurance or have limited coverage, making mental health services unaffordable. Some therapists do not accept insurance, further limiting options. Workforce shortage. There is a shortage of mental health professionals, including psychiatrists, psychologists, counselors, and social workers, unable to meet the increasing demand for care. Racial disparities. Mental health care lacks diversity among providers, leading to a lack of culturally competent care for individuals from diverse backgrounds. Rural-urban disparities. Limited access to mental health care is prevalent in both rural and urban areas due to a shortage of professionals and high demand. Stigma. Stigma surrounding mental illness deters individuals from seeking help, with some communities viewing it as a sign of weakness or facing discrimination. Lack of coordination. Inadequate coordination between primary care and mental health care providers results in insufficient screening and treatment, particularly in emergency room settings. To address systemic barriers in mental health care, a comprehensive approach is needed. This includes improving insurance coverage and reimbursement, increasing the number of mental health professionals, promoting workforce diversity, investing in telehealth and online resources, reducing stigma through education and awareness campaigns, and enhancing collaboration between primary care and mental health providers. These barriers are interconnected and lead to complex challenges. The lack of available and coordinated care often forces other systems to become default providers for mental health needs, straining resources. Resolving these barriers requires addressing competing needs and priorities within the mental health care system, including long-term intensive care for severe mental illness and scalable, affordable treatment for a larger population with significant but less debilitating conditions. Achieving a balance and sufficient funding for both types of mental health care is crucial. A comprehensive approach involving policymakers, healthcare providers, insurers, and other stakeholders is necessary to allocate resources effectively. By investing in a continuum of care, from prevention and early intervention to long-term support, we can ensure appropriate and accessible mental health services for individuals with diverse needs. Dr. Jürgen Unutzer emphasizes the significance of adequate funding for both aspects of care to create an ideal system that addresses the full range of mental health conditions. What prevents mental health concerns from emerging or escalating? Preventing mental health issues requires a comprehensive approach that considers individual, societal, and systemic factors. The COVID-19 pandemic has opened up conversations about mental health, providing an opportunity to break down stigmas and promote awareness. Initiatives like mindfulness training and early detection of warning signs can be effective preventive measures, as highlighted by psychology professor Jane Simoni. These efforts should be implemented in various settings, such as schools, workplaces, and families, alongside ensuring access to mental health therapists to meet the growing demand. Experts also emphasize the role of societal and systemic inequities in mental health outcomes, particularly for marginalized communities. Systemic discrimination affects mental well-being, as noted by psychiatry and global health professor Pamela Collins. Addressing structural disparities and strengthening support systems is vital to promote mental health, reduce inequalities, and prevent the worsening of mental health issues. By acknowledging and tackling these societal factors, we can create an environment that fosters mental well-being for all. Community activism can have a positive impact on mental health, as highlighted by Cantor. Engaging in social causes and striving for positive change can provide individuals with a sense of purpose, connection, and empowerment, contributing to improved well-being. Moreover, having essential resources and support systems is crucial for managing mental health. Access to stable housing, sufficient food, and a strong network of understanding family and friends can greatly influence an individual's ability to navigate their mental health condition. These factors provide stability and support, enhancing overall mental well-being and resilience. We would love to hear your thoughts. If you feel that something was left out or if you want to contribute, leave your comment below. For regular updates and similar content, be sure to subscribe to our channel and activate the notification bell. Thank you for watching.